All right, so Foley catheter demonstration. We're going to first check the medical order, then we're gonna gather our supplies. What I'll need is some washcloths for pericare, my Foley catheter kit. For mannequins, I'm gonna need separate lubricant, a Chuck's pad, and a flashlight. So I'm gonna knock on the door, perform hand hygiene. Introduce myself. Hi, my name is Faith. I'm a nursing student with Northwest Arkansas Community College. Can you tell me your name and date of birth? Are you allergic to anything like latex, iodine, or shellfish?
No,
Are you comfortable right now? Are you having any pain?
no pain.
I would ensure privacy. Then I would instruct my client throughout this procedure. It's going to go much smoother for you if you take some nice slow deep breaths. So I want you to breathe in the roses and blow out the birthday candles. You don't have to do it right now, but I'll let you know when you need to do that. Do you have any questions for me?
No.
For this procedure, I'm going to have an assistant with me since I want to keep the tray sterile while we're doing this, and that way she can assist me with lubricating when we get to that point. So I'm going to raise the bed to a comfortable working height. Gonna lower my patient's head to put her in a dorsal recumbent position. Lower the rail. And then put on clean gloves. Grab a Chuck's pad, put that underneath. Then if I needed to provide pericare, I'd use a new washcloth every time. I'm going to start farthest away from me, top to bottom. Closest to me, top to bottom. And then in the middle, top to bottom. Then I'm going to take off my gloves. I can perform hand hygiene at this point. I'm going to hand my assistant my lubricant for this procedure, and then I'm going to open my kit. I'm going to put the tray between my client's knees. Then I'm going to open using sterile technique, farthest from me, closest to me, out, and then we'll end with closest to me, and then I'm going to square it around, being careful not to cross my field. Going to grab my gloves out of the package. Step back. Careful not to touch more than the 1-inch border. Going to grab my drape, shiny side down, wrap around my hands, and then have my patient lift up their backside. I'm going to open my tray table. Can use that as trash if I need to. Going to connect my syringe to my Y site. Then I would put my lubricant in the tray, but for mannequins we can't use that, so I'm going to grab this out of its sheath. being careful not to let it touch anything. Then I'm going to go 2 to 4 inches and then set this down in my tray. I'm going to open my swab sticks. Then I'm going to spread my client's labia, let them know that I'm touching them and that they're going to feel something cool and wet and that I'm going to be cleaning them. So, furthest away from me, closest to me, in the middle. Now, you might feel some pressure. I want you to take a nice deep breath in, blow it out, and then we're going to get started here. We're going to go in, I'm going to get urine. I'm going to go another 2 inches, grab this with my non-dominant hand, insert the fluid into the balloon. Grab here, disconnect. I'm going to tug to seat it in. I'm going to grab my leg strap. My assistant's going to hand me a leg strap. Remove gloves. Grab the leg strap. Leg strap on. Start lowering my client's legs down. Grab the trash. Then I'm going to get it to a non-movable part of the bed, making sure not to lift this above my client's bladder. I'm going to get them in a comfortable position. Raise the rail, lower the bed. Ensure they have their call light in reach. Perform hand hygiene. And then I would document that I inserted a 12 French Foley catheter using sterile technique. Patient denied pain before, during, and after the procedure. Patient given instruction. Patient verbalizes instruction. Patient educated that they now have a Foley catheter in. They do not have to get up to urinate, but if they need to have a bowel movement, to please let me know and we will assist them to the commode. If they need to get up for any reason, please notify us so that we can get them up. If they start noticing any pain, to notify us immediately. Then I would get an order to remove the catheter. The supplies that I'm going to need for this are a syringe and a Chuck's pad. Knock on the door, perform hand hygiene. Introduce myself. Hi, my name is Faith. I'm a nursing student with Northwest Arkansas Community College. Can you tell me your name and date of birth? Are you in any pain right now? I would ensure privacy. The provider has ordered that us to take out that Foley catheter. We're going to have you do some breathing exercises. Take a deep breath in, blow it out. So I'm going to raise your bed up to a comfortable working height. Lower the head. Lower the rail, assist them back into a dorsal recumbent position. They get on some gloves. Replace the chucks pad if one was not already there. I'm going to take the Foley out of the leg strap. Dispose of the leg strap. I'm going to attach the syringe and let it passively deflate. I can help it along a little bit. Ensure that I got all of the fluid out that was put in, so 10 milliliters of fluid. I'm gonna have them take a deep breath in, blow it out, and then I'm gonna pull out the Foley catheter. I'm gonna put this in the chucks pad, assist my client out of this position, and get them covered back up as I take my bag to the bathroom, empty the catheter into a cylinder, measure the amount of urine that I have out, and dispose of per my facility policy. Gonna remove my gloves, raise the rail, get my client covered back up, put the bed in the lowest position, brace their head in the bed so they're in a comfortable position, ask if they're in any pain. Then I would document, hand them their call light, perform hand hygiene. Then I would document that I removed a 12 French Foley catheter. I emptied 300 mils of clear yellow urine out of the catheter. Educate my client that they now will need to get up to urinate. We may measure the amount of urine that they have initially. If they don't urinate within 6 to 8 hours, we'll notify the provider and get further instructions from there that they need to adequately hydrate, and then the procedure would be done.